ሰላም ሰላም እንዴት ናችሁ? ውድ የዩቱብ ቻናሌ ቤተሰቦች ዛሬ ይዤላችሁ የመጣሁት ባለፈው የጀመርነውን የሲኦሲ ፈተና ዛሬ ፓርት 2 ከ11 እስከ 20 ያለውን ጥያቄ አብረን እንሰራለን ማለት ነው። እስከ መጨረሻ አብራችሁን ሆኑ። ላይክ፣ ሰብስክራይብ ማድረጋችሁን እንዳትረሱ። እንጀምር።
11th. A newly Paris woman came to nearby hospital with weight loss and difficulty of breathing over the past several months. Physical examination results showed lymph gland enlargement, tender nodular, firm liver, bilateral mass and hypogastrium with tender and irregular appearance. The cytological examination also detected ovarian malignancy. What is the most likely stage of the cancer? A. Stage 2. A, B, Stage 2, B, C, Stage 3, D, Stage 4. Answer D. This woman exhibits several concerning signs. Weight loss and difficulty breathing suggest systemic involvement. Lymph gland enlargement indicates lymphatic spread. Tender nodular liver suggests possible liver involvement. Bilateral mass in the hypogastrium and tender irregular appearance are indicative of advanced disease. Given these findings, particularly the presence of liver involvement and lymphadenopathy, the most likely stage of ovarian cancer is D, Stage 4. In the FIGO staging system for ovarian cancer, Stage 1 is confined to the ovaries. Stage 2 involves pelvic extension. Stage 3 includes peritoneal spread outside the pelvis or positive retroperitoneal lymph nodes. Stage 4 indicates distant metastasis, which can involve the liver or lungs. Therefore, the best answer is D, Stage 4. 12. A 28-year-old woman came to a hospital with complaints of dysmenorrhea and dyspareunia that occurs premenstrual and subsides after menses begins. She also had constipation and rectal bleeding with defecation. Physical examination shows that she had tender adnexal masses and pain upon uterine motion. She is diagnosed for endometriosis. What is the most likely manifestation to confirm the diagnosis? A. Pain. B. Constipation. C. Dysmenorrhea. D. Adnexal masses. Answer C. Dysmenorrhea, or painful menstruation, is one of the hallmark symptoms of endometriosis. It is often characterized by severe menstrual cramps that occur before the onset of menses and may improve once menstruation begins. So, while adnexal masses are a significant finding during physical examination, dysmenorrhea, C, is particularly characteristic and widely recognized in the context of endometriosis, aligning with what the question is asking about the manifestation. While adnexal masses are crucial in confirming endometriosis, dysmenorrhea is the key manifestation experienced by the patient. 13. The nurse evaluates a 2-year-old child who was admitted for the treatment of failure to thrive secondary to severe acute malnutrition. The child had good appetite and no edema for 10 consecutive days. The nurse decided to discharge the child. What is the most likely additional finding that could support the nurse's decision? A. Weight for age greater than 85%. B. Weight for age greater than 90%. C. Weight for height greater than 80%. D. Weight for height greater than 85%. Answer equals D. For a child recovering from severe acute malnutrition, weight for height is a critical indicator. To support the decision to discharge, the most likely additional finding would be D. Weight for height greater than 85%. This suggests the child has regained a healthy proportion of weight relative to their height, indicating successful recovery. 14. A 15-month-old child was brought to Health Center for Growth and Developmental Checkup. On examination, the infant can walk independently, but cannot grasp of an object using thumbs and index finger. The child responds to a simple command like, "Wave bye-bye." What was the most likely developmental problem of this child? A. Emotional developmental problem. B. Language developmental problem. C. Cognitive developmental problem. D. Fine motor developmental problem. Answer D. The inability to use a pincer grasp, thumb and index finger, is indicative of a fine motor developmental problem. At 15 months, most children typically exhibit this ability, so the lack of it points to a delay in fine motor development. Therefore, the most likely developmental problem of this child is D, fine motor developmental problem. 15th, a nurse in immunization room found that the refrigerator is out of order. The technician of the health center confirmed that maintenance of the refrigerator could take a maximum of 4 to 5 days, so the nurse wants to store vaccines till the refrigerator maintained. What is the most likely type of cold chain used to store the vaccines in this time? A, cold box with cool water pack. B, cold box with frozen water pack. C, vaccine carrier with cool water pack. D, vaccine carrier with frozen water pack. Answer A. In this scenario, the best option for storing vaccines temporarily while the refrigerator is out of order would be A, cold box with cool water pack. This choice is suitable because cool water packs provide sufficient cooling for a short period without the risk of freezing the vaccines, which is critical for maintaining their efficacy. Frozen water packs, as in option B or D, could potentially freeze the vaccines, which is not advisable. A vaccine carrier is typically used for transport rather than for long-term storage, making option A the most appropriate choice for this situation. 16A Health Center has a total of 20,000 populations in the catchment area, of which infants account 20%. In this health center, the planned annual coverage for PCV vaccine is 90%, with vaccine wastage multiplication factor of 1.11. What is the annual maximum stock level of PCV vaccine in the health center? A, 11, 988 doses. B, 12, 988 doses. C, 14,985 doses. D, 15, 985 doses. Answer A. For full coverage, each child needs 3 doses of the PCV vaccine. Let's adjust the calculations accordingly. Total population, 20,000 infants, 20% of total. 20,000 x 0.20 equals 4,000 infants. Each infant requires 3 doses, so 4,000 times 3 equals 12,000 doses needed. Planned annual coverage, 90%. 12,000 times 0.90 equals 10,800 doses. Wastage multiplication factor, 1.11. 10,800 times 1.11 equals 11,920 doses. 1.11 equals 11,988 doses. So, the correct answer is A, 11,988 doses. 17. A nurse wants to initiate feeding for 1.5 kilogram neonate admitted in neonatal intensive care unit. The infant had a very weak sucking reflex and on risk for necrotized enterocolitis. What is the most appropriate initial step in this patient's care? Pouring the expressed breast milk via NG tube continuously as demanded. Inject 4.5 milliliters expressed breast milk using 10 milliliter syringe at a time per feeding. Give bolus 3 milliliters expressed breast milk via NG tube over 20 to 25 minutes per feeding. Give bolus the expressed breast milk using a 10 milliliter syringe over 5 to 10 minutes per feeding. Answer. A continuous feeding, option A, involves giving milk slowly and steadily over time, which can help fragile neonates better absorb nutrients and reduce energy use. It is especially beneficial for very low birth weight or unstable infants because it lowers the risk of feeding intolerance, gut stress, and aspiration compared to faster, larger feeds, providing a safer and gentler way to support growth while closely monitoring feeding tolerance. A nurse assessed the progress of a 2-year-old child who was on Phase 1 management of severe acute malnutrition. The child was improved clinically with an evidence of reduced edema to grade 2 and complications were completely treated. What is the most likely additional finding used to proceed to the transition phase? A. The edema has to be reduced to grade for a day. B. The edema has to be lost completely for consecutive days. C. Improved appetite evidenced by finishing F75 food easily. D. Improved appetite evidenced by finishing F100 food easily. Answer C. To move a 2-year-old child with severe acute malnutrition from stabilization to the transition phase, the key sign is improved appetite, shown by the child finishing F75 milk easily. This indicates the child is ready to handle more nutrients safely. Edema reduction alone isn't enough. Appetite improvement signals true recovery and readiness for the next feeding stages. 19. A 16-hour-old preterm neonate who was born at home was admitted to the NICU due to inability to feed and lethargy. On examination, the neonate had body temperature of 36.2 degrees Celsius, pulse rate 140 per minute, and blood glucose level of 35 milligrams per deciliter. What is the best nursing intervention to manage the neonate's problem? A. Provide intravenous glucose. B. Put skin to skin with mother. C. Provide milk through NG tube. D. Warm the child using hot water bottle. Answer A, given the neonate's low blood glucose level of 35 milligrams per deciliter and symptoms of lethargy. The best nursing intervention is A. Provide intravenous glucose. This will quickly raise the blood glucose level and address the immediate risk of hypoglycemia. 20. A nurse who is giving immediate newborn care dries and stimulates the newborn. Unfortunately, the newborn do not cry. What is the most appropriate next step for this newborn? A. Suck fluid from the nose. B. Bag and mask ventilation. C. Observe and evaluate breathing. D. Back rubbing and flicking soles. Answer B. If a newborn doesn't cry after drying and stimulation, start bag and mask ventilation immediately to support breathing and prevent brain injury. Guidelines from WHO, ERC 2025, and ILCOR stress-initiating positive pressure ventilation within the first minute. Only suction if there is visible airway blockage, as unnecessary suctioning delays life-saving ventilation. Simply observing risks hypoxia, so early ventilation is essential for the newborn's survival.